tomspring. I'm an exercise physiologist and a health and wellness industry consultant. There's a lot of training programs out there, and there's a lot of good trainers out there. But oftentimes what other trainers do is rely on standard types of programs. So they have a set number of exercises or types of exercises, and they try to apply it to a lot of different people. It's easy and it's repeatable. What the Moses method does is it really follows physiologic science, and it takes an individual who may have different metabolism, different physiology, and different responses, ages, genders, body size, body types, and it applies the physiologic science of metabolism and exercise science to that individual. And they do that by testing them and watching them and monitoring them and looking at their resting metabolic rate, for example, which everybody's a little different. Their oxygen consumption during exercise, which again, everybody's a little different. And their body composition and body type, which everybody's a little bit different. So the Moses method takes all that information and makes a cohesive program for you, the individual, based on your data and your science. And so that really stands out to me as a physiologist, and is really attractive because it doesn't take a universal method and applying it to lots of different people. It takes individualized science and data and applies it to you. Exercise is extremely important for preventing all kinds of illness. Your immune system response is very, very important for virus prevention. If you have a cold, if you have the flu, whatever things we're dealing with, if your immune system is stronger and your body is stronger and healthier, then you're less likely to, number one, get the virus. But if you do, which is somewhat possible, certainly, then your ability to recover from that virus or that illness is that much better the healthier you are. And with COVID-19, we're seeing many people get it, but the people who end up in the hospital, who are ending up on ventilators and unfortunately having serious complications from the virus, are those that have poor metabolism. They're diabetic, they're overweight, they have heart disease, they have other things that cause their body not to respond as well and fight the virus as well as somebody who is healthier. And exercise and metabolic health and being able to fight off a disease like COVID-19 is extremely important. And the Moses method is essential in the sense that the healthier you are and the stronger your body is, and the more you're focused on your own metabolism and improving your own immunity, the better off you're going to be to fighting something like COVID-19 or any common illness that we have, including things like diabetes and so forth. I've been doing this about 25 years, and as an industry professional and a fitness professional for that time, I've seen many different programs. I've been in the certification business for trainers through the American College of Sports Medicine and other organizations that certify personal trainers. And so when the Moses method was introduced to me, I immediately found it to be very, very well rooted in science and at a level that probably many trainers would need to study hard in order to achieve the rigor of what the Moses method is trying to accomplish. But that's what we need. That's what the industry needs. That's what fitness professionals need to think about when they are trying to elevate their game and when they're trying to help more people in a very specific and personal way. In my opinion, the Moses method is revolutionary.